Hello, everyone. Welcome. My name is Madeline Concert. I am the current SAC chair for the Society for Health Psychology. We will wait a couple minutes here to see if some other participants join. But just as a brief reminder, participating in the event today indicates your permission to be recorded and to have this recording be posted on the Society for Health Psychology's website. We're glad to have so many participants here live, and we hope that this provides a really informative panel for those of you who are applying to internship this year, and for those who are applying to internship in future years. Feel free to add questions in the chat box, and we will get to them at the end. We plan to have about 15 minutes available for questions from the audience. And if there aren't necessarily any additional questions, we do have some other ones available that individuals previously submitted. All right, and we'll get started in a couple minutes here. Thank you. All right, well, we will get started. We're going to start out with introductions with our panelists. I will be showing slides kind of throughout the presentation, and I will be sending the slides to those who have registered for this Zoom call and registered their questions as well. So we will get started with our first panelist.
I guess that's me. Hi, everyone. My name is Laura Alward. I completed my internship at Edward Hines Jr. VA, which is one of the VAs in the Chicagoland area. My program was a clinical PhD program. It was Rosalind Franklin University, also in the Chicagoland area. The rotations that I completed on internship, it was set up with 4 different rotations for 6 months at a time, half time. And so I did primary care, health promotion, disease prevention, psychosocial rehabilitation clinic, which is like a psychiatric IOP, and then outpatient therapy. My clinical and research interests include eating behavior and obesity. And I think that's it for me.
Hi, everyone. My name is Brooke Lamphier. It's nice to meet you all. I'm a doctoral candidate in the counseling psychology program at the University of Denver. So I've just recently started my internship. I'm 3 months in. I can't believe it's going as fast as it is. But I'm on internship at the University of Colorado School of Medicine in Denver, Colorado. It's an academic medical center, and I'm primarily in the Department of Family Medicine. My major rotation is primary care psychology, and I'll be doing minors in addiction treatment and likely sleep medicine, possibly burn as well. I have my clinical background essentially is in integrated behavioral health and primary care, psych assessment, eating disorder treatment, and then sport and performance psychology.
Hi, good evening, everyone. My name is Xena Peters. Currently just completed my postdoc rotation, but I completed my studies at Midwestern University, which is right outside of the Chicagoland area in Downers Grove, Illinois. And I was in a clinical psychology PsyD program at Midwestern. I did my internship and I completed it last year at Florida International University. That was at a counseling center, gave me a lot of experience with outreach and really good outpatient therapy. And then this year, completing my postdoc, I completed my postdoc at Ben Taub Hospital, part of the Baylor College of Medicine postdoctoral program. And that was a clinical psychology, health psych sort of postdoc where I had an opportunity to really get good training in outpatient therapy, as well as some exposure to inpatient and consultation and liaison work, to name a few. So I'm happy to be here. Here to list some of my research and clinical interests, and some that I even had a chance to integrate into my dissertation.
Hi, everybody. My name is Nicole Ryan, or Nikki. I finished my internship at the Baltimore VA here in Baltimore, where I currently am. I was on the health psychology track. I had 3 4-month rotations, the first one being on the health psych track, which was consultation liaison, outpatient medical weight management clinic, and I had the opportunity to do bariatric and pre-transplant evaluations. I also was on the neurology and pain rotation, and then I finished up in hospice and palliative care. I am currently at the Baltimore VA in primary care mental health integration for a postdoc. I'm coming from a 5-year clinical PsyD program from the Philadelphia College of Osteopathic Medicine. And my interests are in provider well-being and burnout, reducing stigma in marginalized populations, and also being able to improve the utilization of health psych services within integrated settings.
Excellent. Well, thank you very much, everyone, for introducing yourselves. I did want to put a plug in that a lot of the questions that we received that were submitted did seem to be more directed towards DCTs and sites specifically. So if you're interested in that panel and questions related to that, please feel free to head to this link. Again, I'll be sending out these slides after the panel is over. So at this point, we will now move to the kind of question and answer portion. I would like to start with what is a recommended timeline for the internship application process?
I can start. Ideally, you've started. If you're on this webinar, you probably already have. So I think for me, I had worked on my essays through the summer. I had kind of finalized them. At this point, I was having people read them over. And I was working on my least favorite part of cover letters and trying to really make them very specific to the sites that I was applying to. I also was trying to, well, you guys aren't going to be traveling, so you don't have to worry about that, so that's a good thing. But trying to prepare for that. And I would say really just taking one step at a time. Like at this point, I wasn't thinking about internship like the questions that they're going to ask you on interviews. There's time for that later. I would say at this point, I was really focusing on cover letters, uploading everything into APIC, and hounding people for recommendation letters and telling them like it was due like 2 weeks before it's actually due. So that's what I was doing this time.
Yeah, I can speak to that a bit as well. I think it's really important to take things one day at a time because the application process can get really overwhelming. Particularly if you add in all of the potential interview prep that you might be doing. So yeah, similar to Nikki, at this point, I had finished most of my baseline application materials and was working on tailoring them to the specific sites. And I would say the more notice you can give letter writers, the better, because that can be problematic, as we know, with busy schedules.
I also want to say, even at this point, if you're not at the point where you already have your essays and stuff already written, it's not time to panic. You can really sort of ground yourself, really pause and really think about what you want to convey in your essays. And of course, I agree with the other 2 panelists with talking to advisors and trying to gather those recommendation letters. But there's no need to panic if you don't have it all done now. We're still in September, but really now is the time, if you haven't yet, to start that process and really begin working on the application packet.
Thank you. So when it comes to sites, how did you go about choosing which sites you wanted and what factors did you consider?
I can start with that question. I think this is a great question to ask. I'm not sure where everyone is in this process for folks applying this year, but I took kind of a 2-pronged approach of looking at all-encompassing lists of APA accredited internship programs and really looking at ones that had good health experiences and just looking at all of them and seeing what rotations they offered and kind of starting to pare it down from that. I think this will be a theme that we say a lot in this hour, but I think having a solid idea of what you want from internship before you go into the process is going to really help guide you and kind of serve as a compass, because there's a lot of decisions you'll be making. Things can feel overwhelming, but if as soon as possible you're able to just get kind of like a vision statement or really understanding what you want from the experience, that will also help guide paring down sites, because there's so many sites. It's really helpful to know what are you wanting from the experience, not just rotation wise, but kind of more broadly. So for me, it was important for me to have specific health rotations. I knew that I wanted to do my clinical fellowship within obesity and bariatric surgery. So though I love that, that wasn't as much of a priority to have on internship, because I knew I had it at prac, I would have it at fellowship. And so I wanted to get to do different things, because you'll hear this from folks, but it's really the last time, in a sense, in your training that you get to dabble and really experiment with different opportunities. So I was looking at a list and paring it down that way. At the same time, I consulted people that had already completed internship, advisors, prac supervisors, asking where they went or what they've heard, what they would recommend as good health psych internships, and just word of mouth. So I recommend kind of that two-pronged strategy.
I can speak to this too. I think my experience applying for internship was a little unique in that I applied only to sites within Colorado for the most part, except for maybe one or two, specifically because my goal was to stay here for a variety of reasons. So I ended up applying both to health psychology oriented sites as well as college counseling center sites with a behavioral health minor. And I think what was most important for me, kind of to build off of what Laura said, was recognizing that yes, the internship year is really important, and I really want to be intentional about the training opportunities that I pursue, but also knowing what kind of culture I'm getting myself into, right? Am I coming into a program where the staff are going to support my interests and help me to build training experiences or minor rotations that maybe don't exist that would better align with my goals if I end up matching with a site that's not health psych focused, right? So for me, flexibility was really important. The culture at the site was really important. I applied really more for the people and the values at the site than I did the training, which was really helpful for me. And of course, it's really important to know what kind of postdoc you might be interested in, and if you're setting yourself up well for that. And if you're not, you can talk with your supervisor and figure out different experiences you can get to build on it.
If I could just add to that too, I think what's already been said is really wonderful. And I'll say, kind of going off what Laura had mentioned, talking to people who kind of have followed the path that you want to follow or have the career that you want to have can be really helpful in learning more about their past experiences or who they might know at different places. You'll be surprised what a small world it is. I was not limited by geographic location, so I was coming from Philly and I was applying all over. And I knew somebody who had gone to school in Chicago, but she had friends out in California, and I was applying to some sites out there. And she was like, don't apply to this site, but this is a good one. So just having conversations with people, even where you think they might not know somebody or they might not have an idea, they sometimes really do. And then you can kind of get the inside scoop, which is a lot easier to figure out from a person rather than reading a million brochures.
I wanted to add one more thing too. In terms of health psych sites in particular, it was really important for me to differentiate between actual integrated multidisciplinary teams and co-located care, because I wanted to work in a setting where we would be collaborating and treating patients together every day, as opposed to just consulting here or there. So that's an important distinction to make, I think, particularly if you're looking at primary care.
Going off what you were saying, Brooke, as far as being regionally limited, can you speak a little bit more to that?
Yeah, absolutely. You know, I'm not going to sugarcoat it. It was challenging, I think, to get through the application process. I ended up creating 2 different sets of applications, really. I had very primary care, integrated behavioral health focused materials, and then materials that were geared a little bit more towards college counseling. So for me, I ended up feeling like I did kind of double the work on the application side, but it really paid off because I got to really reflect and figure out, okay, like what am I actually looking for in a site? Can I make this site work if I were to match there, even if it's not my number one choice? And so it worked out pretty well. I would say that one of the keys for me was speaking to the supervisors as much as I could in advance, talking to current interns, really figuring out what characteristics or traits or I guess theoretical orientations would be the best fit in certain settings. And that helped me tailor my materials then to the site, which is not always recommended. You kind of want to pick a site that fits you, but when you're geographically limited and you don't have a lot of options, it's important to really kind of be flexible in the way that you approach your applications.
As far as the number of sites, what is recommended, or how many sites did you apply to?
So I know the recommended is 15. I would encourage people to stick around there. I didn't necessarily follow that. I applied to 17, but I knew a couple of them were kind of reaches for me, coming from a PsyD program and kind of looking at what it had listed on APIC of how many, PsyD people that they have had before compared to PhDs. So that was something that I really looked carefully at. And so I added a couple in, probably more than I needed to, just based on my own anxiety, quite honestly. Looking back on it now, I maybe would have taken some sites off there and stuck more around the 13 to 15 range. I think I applied to 17. I think I got like 12 or 13 interviews, something like that. So just keep in mind too that like however many interviews you get offered, you really should go on all of them and not back out, because it is such a small world and you don't know if you're going to be applying there for fellowship the next year. So you don't want to burn bridges in that sense. So just think really about like, oh, and also the application fees. Like, I don't know what it is for you guys now, but like $35 a pop is pretty expensive. So that's something that I really tried to think about, like, okay, like what are my real chances here and how much do I actually want it in terms of that?
I like to talk about
go ahead.
Well, I was going to say, I totally agree with Nicole in terms of you maybe trying to stay around the 15, really looking at your budget and all of those components. But another thing to consider is I had a list that was much larger than that when I first started. And then I sort of narrowed down, like, what am I looking for on internship? Are these sites sort of, am I going after certain training that they have, or what do I think I'm going to get out of each one? And that really helped to narrow down the list. I think there is benefit, and I think there's even data on the APIC website to talk about there's not maybe a whole lot of more benefit applying for more than 15 or 16 sites. So I really encourage you to review that data. But I really valued and really enjoyed working with my training director at my university during that process to really help me to sort of streamline what it is I'm looking for on an internship site. It can get very overwhelming when you hear about maybe how many PsyD versus PhD students have been accepted in the past. But when you really work, I think, throughout the process with either an advisor or your training director at your university, they can really help you streamline and get closer to that 15 number. And it can get really expensive flying around the country. I don't know how it will be right now with COVID. Maybe everything will be virtual, so maybe there's a benefit to that. But I do remember I felt like I was a jet setter flying around the country during my internship year. So keep all of those things in mind.
I'll also add, go ahead.
Sorry, go ahead. I was just going to say it is possible to apply to less if you'd like and still match. I applied to 10 and match. So it's kind of a pick your poison, I think.
Yeah, that's what I was going to say. I had friends that applied to 6, 7 and still matched. So it's really, there's no right answer here.
With regard to VA settings, do VAs typically prefer applicants who've worked at VAs before, and kind of speaking to that, the same geographic location?
So this was what I was told, and I knew that I wanted to work in a VA. So I did my last practicum before internship, I was at the Philly VA. I don't know how much of a difference it actually makes. I will say it made it easier, at least for me, when going on interviews, to have a general idea of how VAs interview. They do performance-based interviewing, which can be a little bit different than some other sites. I could say that I'm familiar with, some of the different programs that they offer that do tend to be national. However, I had experience outside of the VA in primary care. Like, my primary care experience was not within the VA. So that was something that, one of the things that you can do is say, well, I haven't had specific experience in the VA in this, these skills or these past experiences led me to be a good, applicant for this, setting for X, Y, and Z. The other thing is you can say why you might want to work with veterans. I talked a little bit about that in my essays. I talked a little bit about it in my cover letters, not much, but basically that I want to kind of serve this population. And that my goal was to be a career VA psychologist. Don't lie if that's not your goal, but that was what it was for me, because they will ask you about that on your interviews. And I was worried about the geographic location. I was told that nobody from my school, I came from a smaller school, but nobody from my school had gotten interviews to, VAs out in California. I got some out there, I got some in Florida. So it really, I don't think you're limited by geographic location. The way that I kind of spun it in my cover letters was that I've experienced, training in this region, and I really want to see what it's like in a different region with different populations, with people who have had training and different experiences. So that's a way that you can kind of jump the geographic limitation, if you think that is one.
Also, to build on that, geographic location didn't come up for me at all in my interviews. Like, folks knew I was applying mostly locally, and it didn't matter, right? They were most interested in why I was interested in their site and what would make us a good fit. So something to keep in mind, something that I stressed about a lot at the beginning, didn't actually come up at all in the interview process. So,
with regard to kind of questions about applications now, what advice would you have for writing the essays?
I can jump in here. I think the essays is like a wonderful opportunity to really share beyond your CV, beyond your cover letter. The best advice I would give is really follow sort of what each essay is asking you for. You have a limited amount of words that you can really use to highlight maybe your autobiographical essay or your research experience. And try to make it authentic, like make it you, like tell your story. Why are you even in psychology? I think everyone's essay will be different and should be different because we're all unique. And the site wants to know who you are. And that's where the revisions come in, maybe writing it and leaving it alone for a few days, and maybe having, maybe someone look it over. Make sure it's grammatically correct, of course, but it is truly an opportunity for you to highlight the best of you and start early, start right away, write a little bit every day. That would be the advice I would give, and really follow the guidelines that they lay out for internship for each essay, so that one essay is very distinct from the next when you're going from topic to topic.
I'll add too, one of the things I worried about when I came to the essay was the last one, when you have to talk about your theoretical orientation or whichever one that is. I came from a practitioner scholar program, but I was applying to a lot of scientist practitioner internship sites. And I was, oh my God, they're not gonna take me if they know this and read this essay. So that was just something that I addressed very briefly in my cover letter to the specific site, saying like, this is my, like, while this is the program that I come from, I really want to get that scientific, research aspect that you have. So again, like, don't freak out. Like Xena was saying, like, be true to who you are. They're going to figure it out when they meet you anyway. And you're great as you are. So be authentic.
I would add too, if you can have multiple folks read over your essays, if that's something that's comfortable for you, it's helpful to have different perspectives.
So within, the cover letters and kind of determining what you want out of an internship, how do you balance wanting health psych experience when a site kind of offers more general things?
If it's okay, I'll probably start that because my site was a university counseling center. So it was more so, I would say, a general psychology internship, although it was a health service psychology labeled internship. But I think most internships, from what I could remember when I was interviewing, they offer opportunities maybe for you to do a special project, or maybe if you have a special interest. And so my site was one of those sites that offered the opportunity to do a special project. That might be an opportunity for you to sort of see if there is a way that you can maybe even do something related more to health psychology while you're on that internship, and craft it with maybe your supervisors so that you're maybe coming out with a new experience that you didn't have before internship. So I would really encourage, maybe even during the interview process, asking questions about opportunities for special projects or opportunities to do some more health psych rotation care. You'll be surprised. Even at a university counseling center, you have clinicians and supervisors from all backgrounds, and some who have trained in health psychology who would be willing to sort of work with you if that's an area that you maybe want to really focus on. So for instance, when I would have a case that comes in that was maybe more related to health concerns, I would be able to sort of really take time and review it with my supervisors from sort of a health psych approach. So there are opportunities. I think you just have to be willing to ask during your interviews, and then also see if there are opportunities to do special projects.
And I'll share some of my experience because I think that maybe the process I went through might not be unique just to me, but when I was considering internship programs, I really was excited to finally be able to focus more so on health, and I genuinely didn't have as much interest in having more like general psychopathology rotations, because I did that for the first 2 years of my program. But going through the process helped me realize the benefits of taking part of internship to really have that be the last time I'll do more generalist training. And so I think that I went from feeling excited and antsy about what I wanted to then being more grounded of thinking about what I needed. And I think the internship placement that I chose is a good representation of that. I picked a VA. I could have made 75% of my clinical work be health psych, but I chose on my own after being there to have it be 50% health psych, 50% general psychopathology. And I didn't have to, but I think I just kind of, my priorities shifted, and I was thinking more about what would be helpful for me long-term instead of just having what I wanted in that moment. So I guess the point of it is to, again, think about what you want, what you need, where you're headed, what's going to serve you well. And really, you can find an internship program that lets you do mostly health psych. If that's really what you want, you can tell from their brochures and their structure, and you can find that and avoid doing some more general psychopathology if that's really what you want.
So for sites that typically accept PhDs more readily, how can PsyD students stand out in the application process?
Well, I think that's for Xena and I, right? So what I did is, I mean, I'm a very clinically oriented person. Obviously, that's why I chose a PsyD program. Having at least, I think it's really being able to find a way to talk about, well, seeing first of all, like, are they looking for somebody who's going to be doing a lot of research? So the program that I matched at and ended up really wanting to go to, they had a research project, and I was like, ugh, like, no, I'm not a research person, but it was a requirement for the internship. And so I just found it, I asked more about it during my interviews, and just found it a way to make it mesh with my interests. So I looked at kind of what's going on with referrals from oncology providers within an integrated care setting, and how can we improve that process? So more of like a aspect in that way. So finding ways to figure out like, what am I passionate about and how can I bring that in here? I will say highlight your clinical strengths, like, highlight the variety of the things that you have experienced, really being able to say like, okay, well, I may not be, I'm just speaking for myself here. I may not be a master at SPSS, or I may not have a million publications under my belt, but I've been able to work within many different settings with many different people, integrated care, and this is how I want to help contribute, take the clinical skills that I have and contribute to the team here. I think, there's going to be some places where you're not even going to get an interview because they're solely looking at publications. And so you're not even going to make it on the radar. Or because maybe PhD students have had more hours and accumulated more hours than you did in a certain area. Don't harp on that. Don't compare yourself in that way. Really think about what your strengths are and how you can bring that to the table. And if you really want to be there too, right? Because you are bringing something to the table. So really just finding a way to say, this is what I offer. These are my skills. And at the end of the day, what I found at least is that sites want somebody who's going to be flexible, who's going to be able to work within a team, and who's going to be able to work with the patients that they're serving and be culturally competent. So if you can pull that stuff in and say, I can do that, you're going to be just as competitive as a PhD student might be. And I would find a way to highlight that within your essays or within your cover letters.
Nicole, well said. The only thing I would add to that is that, most internship sites, it's still a training opportunity. So they don't expect you to have every skill or everything figured out. It's really, they want to see, is this someone that we could train for a year? Are they open?
Oh, we might have lost a little bit of connection there with Dr. Peters. I will move on to just the next question, and hopefully she can come in and finish her thought there. So with, thinking about marketability, is taking an extra year, how does that impact one's marketability?
My experience with this has been that it doesn't at all. I think PhD and PsyD programs really range in the years it takes to complete them. My PhD program at DU, folks can complete it in anywhere from 4 years to 7 or 8 years. I myself ended up taking 2 extra years for a professional position that provided some specialty clinical training that I wanted before internship. And as long as I was able to really clearly articulate the relevance of the training opportunity and how it supported my professional goals and growth, no one had a problem with it, even in the slightest. Do what works for you.
Agreed. I'll say, I was worried about not having enough hours, like I was saying earlier, to compete with the PhD students. And in some sites I may not have, but like Brooke was saying, as long as you're able to say, these are my strengths, this is what my training has done, and this is going to bring me forward, it doesn't really matter. At least that was my experience of it. Oh, Xena's back.
I didn't realize you couldn't hear me for a while there, but yes, I'm back. That's probably one thing to think about for internship interviews is if you do have all of these Zoom interviews, things can happen with internet technology. So be prepared for that. But all I was saying is that, when you're applying to internship, just be mindful that they are looking for someone that is willing to learn and that comes in with the trainee sort of approach, that you don't necessarily know everything, and that's okay. I think internship sites want to know that you're open and flexible to be able to present what you do know, and then also be open to learning new things. So either you come from a PsyD or a PhD program, I would not let that get in your way. Absolutely not at all. It wasn't really even a factor I really thought about during my application process. I would look at the data, and if I saw a site that I liked, I'm one of those people, I go for it. The worst thing could happen is they don't invite you for an interview. But, if it's a good fit for you and you think that you would be a good fit there for them, I think it's an opportunity that you shouldn't you shouldn't, avoid taking. Go for those opportunities.
I'm not sure, Xena and Nicole, if you'd agree with me or not. There are several folks in my intern cohort this year who have a PsyD or are working towards their PsyD, and a lot of them spoke about their experience with testing as something that really helped them stand out when applying next to PhD applicants who might not have as specialized or as many testing hours. So that's another thing to keep in mind.
I would agree. That came up quite a bit on interviews. And, I don't know how much each type of program gets in terms of testing, but in PsyD programs, it is a big part of a big component of our training. And many sites, especially if there's a big assessment piece, that might be something you can highlight. It might be a plus where maybe research is an area that you're still working on.
So as far as the whole application process went, what do you wish you would have known before going through the application process, and what would you have made done differently?
I can share some of my thoughts on that. I was really excited about the internship process, so I think I just over prepared, and so it was hard for me to sit and think like, what didn't I know? Not to say I usually know all the things, but I was excited, and then I also had a lot of anxiety around the process because it just felt like a huge deal and a culmination of all of the training. With that said, someone already mentioned this before about letters of rec. I found it helpful to give some advanced deadlines for letters of rec, and I was careful about how I phrased it. I wasn't trying to make it sound like I was blatantly lying, but I said, our deadline is this. That's our deadline. I didn't say it's due with the program, but of course people want to support you, but as you get further in your training and into fellowship, you really I've gotten a better understanding of people's perspectives, and not everyone's going to have it be as high of a priority as it is for you. So for me, it felt like the most important thing, and I would feel nervous that the letters of rec were a couple hours before the deadline. So I think setting those deadlines was helpful. Scheduling interviews felt like the Wild West to me. I was so surprised how there's like almost no rules. Like people can just do whatever. They can email you at random times, and it's just a race to get back. And so I think me being type A helped in that moment, because I was like, all right, first come, first serve. I can do this game. So just know that there's no rules with the scheduling part. But finally, people say to trust the process, to trust the match. That can feel hard to do, and I'm sure everyone will get tired of hearing that. I was tired of hearing it, but now on the other side, it clicked, and I really get what that means, that it is a mutual match. It's supposed to be what's going to fit well for you, where you fit in, where you're going to be appreciated and cultivated, and that usually comes out in the whole process. So in hindsight, I could have been a little less anxious and trying to control things. I did get my first choice, and so I'm so happy with where I went for internship. But, looking back, even if that didn't happen, all of the sites were so good. I could have ended up at almost any of my sites, and it would have been lovely. And so maybe I could have saved a little bit of energy of not thinking that it was like the end all be all. So that's my 2 cents.
I love all of that, Laura, and a lot of that resonates with me. I think just a couple points for me. I wish I'd given myself some more grace. Like at this point, you are well trained, you know quite a lot, and it's okay not to know everything. I think I felt a lot of pressure to be able to answer whatever potential question a site would throw at me, which led to a huge amount of preparation that really didn't need to happen the way that it did. So give yourself some grace and trust yourself would be one point. The other thing that I wish were different is that sometimes I found retrospectively it might have been helpful to go to folks outside of my cohort or intern class for support, because I found anxiety can be really contagious, right? And we're all kind of in the same stressful space, going through the same pressure-filled time. It can get competitive and hard not to compare yourself to other folks around you, particularly when results about interviews are coming out. So take care of yourself, set some boundaries, and maybe look outside your program would be my 2 cents. Oh, and one more thing, make sure you look up all mandatory reporting laws in the states that you apply to, because you will be asked that.
Yeah, I'd add to what Brooke said, like have your people outside of your program who are not super anxious, but then also have your people inside, because I found myself getting really frustrated with my family and friends who had no idea what we go through. So it's nice to have a balance with that. Again, have the grace, absolutely, totally important. And I would also say, like, know that you're interviewing them just as much. And that was really important to me, being sure that I asked people, like the people that were interviewing me, like, what's your favorite part about working here? What's your least favorite part about working here? Asking the interns and the fellows as well, because that says a lot about a place. And so you don't have to be Little Miss Performance or Mr. Performance. And if you don't have an answer to a question, it's totally fine to say that. They're just looking for somebody who's open and receptive and flexible and humble. Have some humility there as well. And have fun, because it is actually a fun process if you let yourself have a little bit of fun.
Can I just add that it was really fun bouncing all around the country? It's kind of like you don't think about the expense of it or what it's like, but you really get an opportunity, even if it's virtual this year. Interviewing is truly an opportunity for you to kind of imagine yourself either living in that location, can you see yourself there for a whole year? Think about all those components. It's not just matching the site. You actually have to live and have a life wherever it is you may match. So I think enjoying it and being kind to yourself in the process, finding some way to do self-care truly as you prepare for these applications is a necessity, in my opinion. Either that's enjoying your favorite meal or talking to a friend about something completely different, separated from internship applications. Finding time for that in this process will, I think, help you to sort of navigate all of the different feelings that will come up for you.
Excellent, thank you. We do have one question in the comment box. Again, if individuals want to ask questions, we'll answer the one that's in the comment box right now, and then we do have a few others lined up that we can touch on. So would anyone like to speak more to their experience with primary care?
It's like waiting for Brooke to unmic because we've been doing it the whole time. I love primary care. It's my homeland. It's super fun. It's really interesting to see how different it is doing telehealth. So I would encourage you, like, ask questions about that, how things are different now doing telehealth, how much sites are doing telehealth, because I know it totally varies. I've been able to see a lot of really cool things. So sometimes I just do straight up assessments, and it's more of kind of a triage and figuring out what's the best place for this person. Should they go to trauma? Should they work, with me for some like problem solving stuff in primary care, very brief? Should I refer them to mental health because they need way more than that? A lot of it is working with multiple different teams. So I have 5 different providers who I'm their contact person. They give me warm handoffs. I'm doing things like weight management, smoking cessation, problem solving in terms of, I got my prostate removed and now I can't perform the way that I used to, or I have intimacy issues or things like that. A lot of it too can be collaborating with social work or with oncology, different specialty clinics, which can be really fun. I would ask, figure out what the team's culture is. Every team has a different culture. Every provider has a different way that they like to learn, how many medical students and residents are kind of running through. What's the balance in terms of what's expected of you. Some sites have the opportunity for you to do pre-surgical evals or transplant evals, or work with some more, do more groups or do more individual-based things. So there's so many different options in primary care, and it's super fun, and I geek out on it. So I'll put my email in there if anybody wants to ask me about it on the side, because I could talk about it forever.
And I think I have a lot of overlapped experience of what Nicole said, but just to kind of give a different perspective, interestingly, I was a little bit surprised how I didn't take to it as much as I thought that I would for primary care. So for internship, again, I was at a VA, so I did primary care for 6 months, and it was half time, and it was co-located primary care. So I was the only mental health provider tucked into a primary care clinic. And so I had, it was like the trainee office, but I had an office in a clinic. And for that clinic and those providers, it was basically just me. And so I think if you haven't had that kind of experience before, it is pretty different. Though you're very integrated into the team, I was surprised of how aware I was of how I felt a little bit on an island from psychology, which this might be familiar to folks in health psych, that this becomes kind of its own set of professional development issues or how you deal with your sense of identity as a psychologist. But I had to deal with that disconnect of saying, I'm used to having more contact with mental health people in my professional work. And that wasn't quite the case anymore. I was also surprised a bit how much it was triaging and not, it's brief treatment, but I guess it wasn't the way that I thought. It was a lot of like assessing and kind of shipping people off to places and kind of, triaging. And I just didn't quite understand that's how it would feel. And I just don't think that's how my skills are best used in that setting. And I thought I would love it. And I thought it would be a lot more similar to, I did cardiac rehab and some other stuff, and it was different in ways I didn't expect. So just to offer a different perspective.
I can add a couple thoughts on primary care in an academic medical center setting. This is my second year at the CU School of Medicine. I did a practicum year here as well. And one of the things that I've really enjoyed is how integrated our team actually is. So there's 6 supervising psychologists who all have different specialties and roles, and then usually anywhere between 8 to 10 trainees. And we have 3 psychiatrists and psychiatry trainees as well. And it's a teaching hospital, right? So our clinic is entirely oriented around learners. So there's 3 years worth of medical residents along with attending physicians all in the same clinic with us. So there's a lot of integration across the different learning disciplines, which I found to be really rewarding. Academic medical centers often offer opportunities to teach or train medical staff as well for people in behavioral health. I participate in what's called a Foundations of Doctoring course, where we get to provide education and support on communication skills and how to develop rapport with patients. So kind of some of the basic counseling skills that we learned a long time ago, we get to introduce across to a different discipline, which is really cool. So I've really appreciated the collaboration with the medical side at our clinic. I did also want to point out that supervision is sometimes really different in a primary care setting. So for example, our clinic is on what's called the precepting model, which most of you I'm sure are familiar with, where the supervising psychologist has to be in every visit for a minimum of 15 minutes. So it's a lot of feedback really quick, a lot of co-therapy, a lot of in vivo interventions and changes that might not happen in another setting. I've found that works really well for me, particularly in a brief-oriented setting, because you get to take in and apply the feedback really quickly. But it can be really uncomfortable and challenging at times. So maybe a good question to ask the sites you apply to.
Excellent. Well, thank you. We'll move on to kind of some of the other questions that were asked in the registration process. And if anyone else has any questions, feel free to put it in the chat. Given that on-site interviews are unlikely this year, what could applicants be looking for in the interview process to help them determine what's going to be a great fit for them?
Well, when I was interviewing for internship, we did have some sites, I would say in particular college counseling centers, that only did video or sort of Zoom sort of interviews. And during my experience, I could tell you that I was looking for the dynamics in the room. I was looking for, visually, that the current interns look happy. Were they really being genuine, in my opinion, on what their experience is like? I think what you could really do is really ask tailored questions. It may take some more effort to make sure you're asking more direct and clear questions. For instance, I ask questions of interns of like, what are your hours like? Are you really there for 40 hours a week, or are you there till it's done? Is that 50, 60 hours a week? What is your week look like? Asking, is it what you thought it would be when you actually arrive? And would you choose this site again? But asking really tailored questions of not only the interns, but also the supervisors about what they're looking for in an intern, especially if the intern is coming in the midst of COVID, and maybe a lot of the therapy that you'll be providing will be virtually. So I would say take the time once applications are submitted and really write questions that are tailored to each site, so that you are really taking as much effort as possible in the virtual world to get your questions answered. And pay attention to the room. They're paying attention to you. And remember, I think someone else said it, you're interviewing the sites as well, right? So you want to make sure you're getting some vibes, virtually at least, of what it would be like to work with that group of individuals. It is different, but I think, from my experience, the site I ended up at was a site that I did not go in person. I did it all virtually. And I really felt like what I saw via the web and what I had in person was very much a good match and pair. So I think you can tell a lot through virtual interviews as well.
I could not agree with that more. I did half and half too. And I actually had a couple of really strange experiences where I couldn't even see the folks that I was talking to on Zoom, or it was set up really poorly. The lighting was really off. So it was kind of like this creepy shaded Zoom interaction. So I think I agree. You can tell a lot about how organized the site is, how they typically communicate, how prepared they are for interviews, just by how they set up the call, right? And how they're interacting with you. And something else that I found to be really important was that a couple of sites, you could tell were really scripting their interviews, right? There were kind of staged efforts at building rapport versus folks who actually showed up and approached the interaction as a couple of humans getting to know each other, right? So there's a very different feel across sites that you can absolutely pick up virtually as well.
If I could just say something on that, because the VA, depending on which VA you interview at, some of them are told you are not supposed to have any affect. You're supposed to just ask these questions and wait for the person's response. And I didn't know that. And so I went into some of these interviews being like, oh my gosh, these people are awful. Why would I want to come here? And then I went into the next interview and the person was like, so you know that we're supposed to ask you these questions and we can't really give you feedback. And I was like, oh my gosh. And so it was such a relief. So that is something that I was not prepared for, that just, consider it. But, you can also, I think asking the current interns and fellows is the most helpful thing, because they'll give you some of the inside scoop on that. Are they really that formal, or is it more of the interview process?
Nicole, I'm so glad you mentioned that performance-based interviewing at VAs, and that's that phrase, that's what that's called. It would have been a shame if we made it through the whole hour and no one mentioned that, because I also didn't know in advance. And that's something for that question I should have said, what do I wish I knew ahead of time? To be prepared for that, because it violates social norms of, especially in psychology, we're expected to have a certain level of social skills, especially if you're going to go into clinical work. And it's just, it's very unnatural to know you're in a situation where you're being evaluated and then just be met with no reaction. And it makes sense from an assessment-based perspective. They don't want to inadvertently reinforce responses. So look it up if you're not familiar with the concept. It's called performance-based interviewing. But I genuinely don't know how I made it through as much of the process as I did without my DCT, classmates, other people being like, hey, just a heads up. It really throws you off. I was able to kind of rebound and just deal with it and understand it. But I know some of my friends and classmates, especially if they deal with more social anxiety, that could be something that really got in their head and maybe affected their experience or their day. And it doesn't need to be that way. So look it up. You can even Google common performance-based interviewing questions for the VA.
Excellent. Well, we all have really appreciated you being here and providing your wisdom and advice in this very complex process. And it was really nice to hear about the information you had regarding virtual interviews, because I know that's going to be a bigger component this year compared to years past. I would like to thank everyone for being here today and to kind of open it up to see if there were any last thoughts or comments from any of our panelists, or if there were any last minute questions from any of the participants.
I'd just like to say you guys have everything you need. You know, really trust yourself. You've come this far. Now that you're at the point to apply for internship, it's just one additional step to climb. But you should feel proud of yourself that you reached this monumental moment. And good luck with matching. I'll be here in a few months, and I hope you all match to the place that you will really grow and develop as a top clinician.
I'll say too, after you finish interviews, if there's somewhere that you cannot picture yourself, I would encourage you not to rank them. That's what I did. There were a couple of sites that I couldn't picture myself at, so I just decided not to rank them, and I was terrified about it, but it was fine. I know a couple of people who didn't match first round and matched second round and were fine. So as much as people tell you you're gonna be fine, you really will be. You're not gonna believe it, but you really will be. Good luck.
And it was mentioned earlier, but just do try to have fun in the process. It might not be everyone's cup of tea, especially if you don't like meeting a bunch of new people, or if you get Zoom fatigue, or if you don't want to be a clinician and it's just a mandatory part. But just with all of that in mind, there are some good parts to it. Try to enjoy it. And though it's going to feel like it does stretch on and on, it will end. And it really is just something that has to be done to be able to finish up your program. So just keep that in mind.
Excellent. Well,
I do see something that somebody asked a question that I do have an answer to really quick.
For sure.
Somebody asked, were there any surprising health-related questions? I was given an example of a patient that I might see. Be prepared for that. They'll give you some vignettes. And they were looking for something really specific. It was like her husband died, and she's going to the bathroom a lot and waking up in the middle of the night. And it was like something that was like related to her diabetes. It was like a symptom of her diabetes. And they really just want to see that you can like run through case conceptualization, which you can. And as long as you give some sort of answer and thinking process, because like at the end of it, I got the answer because it was like, oh, it's diabetes. And I didn't know that was the thing for it. But so it was just a learning opportunity for me and kind of asking that. So don't freak out if they ask you a question that you don't know the answer to. It's likely going to happen at some point and you'll be fine.
Yeah, I can add to that too. Every health psych interview I did, I had at least 5 cases, like probably one in every interview. And I found that they were often like common presenting concerns for clients at the site, right? So in primary care, you want to be prepared for like comorbid behavioral health and physical health concerns, maybe difficulties managing chronic illness or substance use on top of maybe depression or anxiety. And also I would prepare for a PEDS case. If you're interviewing at primary care, an integrated primary care site, just to kind of have an idea what services are available, how you might approach a referral for a kiddo.
Excellent. Well, thank you all for being here. Just another plug for the DCT panel that was held last month by our past chair for the Society for Health Psychology Student Advisory Council. That link will be in the PowerPoint that I send out to everyone. Additionally, if you are not a member of Society for Health Psychology Division 38, I would highly recommend it. We provide really great resources for students and trainees. The fee to join is only $30, and that will carry you through the end of 2020 and full 2021. So if there aren't any last thoughts or comments, I want to thank all the panelists for being here today. I think you guys provided some excellent advice, wisdom, and we really appreciate you sharing and taking the time. All right. Thank you very much, everyone. All right. Have a nice night.
Bye.